Children are highly vulnerable and serve as primary target for sex trafficking operators. In the United States, it is estimated that nearly 170,000 youth find themselves homeless and vulnerable to sex trafficking circuits on any given night. South Carolina rates in the top 20 states with the highest amount of sex trafficking occurrences. The state of South Carolina has prioritized a series of actions intended to mitigate the issue, and in many ways, the effort serves as an example to the nation. Yet, emergency care professionals remain undertrained and underprepared to serve as first responders. Medical personnel are often underinformed and ill-equipped to offer trauma-informed care when they encounter victimized youth. Our presentation focuses on the role medical personnel should play serving as frontline interventionists in the fight against sex traffickers, and that by healthcare professionals to be effective in their efforts, a system-wide training would be best practice for employing trauma-informed care techniques when interacting with potential victims. With sex trafficking developing into the largest undetected and lucrative illegal enterprise in the United States, studies show that adolescents and young adults between the ages of 13 to 21 experiencing homelessness are quickly becoming the highest targeted groups by sex trafficking affiliates. Many of these homeless youth suffer with the burden of an abusive home life or aging out of the foster care system. When coupled with the American entertainment industry's constant perpetuation of the idolization of sex, these vulnerable youth are often easily seduced by the notion that their bodies have the ability to save them from a life of terrifying instability. With the reality of limited options, it is easy for these persons to succumb to the sex trafficker's sweet promise of love, family, and creature comforts that were left behind when the streets became their new home. The escalating presence of child trafficking operations can be attributed to several critical factors. The biggest ones of concern are the insufficient legal and legislative protections, along with the effects of capitalism on commoditizing human life. More importantly, the limited awareness at the community level of understanding of the indicators and realities of sex trade all serve to compound a growing problem. Although a coordinated series of multi-sectoral interventions are necessary to fully address this growing challenge, we offer a clear recommendation about the role that properly trained healthcare professionals should play in identifying, responding to, and intervening in an effort to rescue exploited children and youth. More than 80% of victimized youth visit medical facilities to address medical concerns. This is telling us that the most trafficked youth are visiting medical facilities during the time they are being trafficked. In a survey completed by physicians and social workers toward the end of the decade, over 60% of respondents indicated that they'd never received training to recognize the signs of sex trafficking, and most identified lack of training as an obstacle. Most youth experiencing sexual exploitation are seen at medical facilities during their victimization to address medical concerns related to their forced lifestyle. But the capacity of medical personnel to detect victims of commercial sexual exploitation of children, also known as CSEC, is limited. Pediatricians, urgent care providers, and emergency medical personnel generally have inadequate information on CSEC and how it should be addressed when suspected. Since tools for identifying sex trafficking victims are limited, clinical validation of the crime through the healthcare setting remains challenging. Survey findings have suggested that 50% of sex trafficking victims visited a healthcare provider during the time they were actively being trafficked. Yet the healthcare provider failed to realize that they were victims of sexual exploitation. Thankfully, in the state of South Carolina, there is no statute of limitations for child sex trafficking, improving the chances of catching and prosecuting perpetrators on multiple counts. By mobilizing a series of sex trafficking task force in the state of South Carolina, reported cases have increased by more than 300%. However, is this really enough, and more importantly, how do we get this to work in our favor? Societal capacity to mitigate and combat child sex trafficking is entirely predicted on its ability to first recognize the issue as a growing ill and to establish a new set of behavioral norms among those who frequently and often unknowingly interact with the victimized youth. As previously mentioned, medical personnel have the most opportunity to see the victims as they are treated for venereal diseases and on-the-job mishaps, leaving these professionals as our first line of defense. Detection and intervention through trauma-informed care can prevent re-victimization and potentially help identify perpetrators. With a lack of a statute or of limitations, a database that is monitored by law enforcement of suspected criminals can be informed by medical personnel and help catch traffickers that can be prosecuted for multiple victims, not just one case. This not only helps the child in question in that moment, it takes the criminal out of the circuit permanently. Lexington Medical Centers treat nearly 63% of the population living in Lexington and Richland counties. Currently, healthcare professionals at these facilities and throughout South Carolina do not universally receive consistent training in human trafficking awareness. Sexual assault nurse examiners, SANE for short, are registered nurses who have completed specialized education and clinical preparation in the medical forensics care of the patient who has experienced sexual assault or abuse. Few personnel within the Lexington Medical Center's emergency room and urgent care clinics are part of SANE, while fewer still are trained in being able to spot and identify sex trafficking victims. A system does exist in South Carolina allowing for medical personnel to reach out to the sexual trauma services of the Midlands and have their patient provided with an advocate who has gone through an extensive training in sex trafficking and trauma-informed care. However, if medical professionals are untrained, the benefits of this outside organization essentially do not exist. Our recommendation is a tailored trauma-informed care training focused on preparing medical professionals to identify and support patients exhibiting indicators of sex trafficking victimization. All content portrayed should be identical in subject matter across the state of South Carolina and annually analyzed to stay abreast of factual accounts and information from sex traffic survivors themselves. Additionally, attention must be given across ethnicity, gender, and developmental factors, as well as acknowledging the 3 distinct levels to sex trafficking elimination. This trauma-informed care will be taught to healthcare professionals in their first year of their careers, since early training in TIC will improve patient communication. Luckily for South Carolinians, we have an organization, Lighthouse for Life, willing to partner with medical professionals and organizations across the state of South Carolina. Many survivors of sex trafficking have spoken of a sense of alienation when it comes to medical providers' lack of worthwhile patient connections. Trauma-informed care trainings allow for trainees to develop the understanding that will fully support the needs of the victims. The idea is to instill the sense of moving forward from the experiences, not just burying them before moving on with their lives. The victims need to feel as if they can speak freely about the events they had endured when they are ready. This can be obtained through the principles of trauma-informed care. Care must be taken when considering the events that lead up to the person becoming sex trafficked, the experiences endured during their time being sex trafficked, and finally, the lasting effects sex trafficking plays on the victim. Additionally, realizing the victim's situation, recognizing the signs, responding accordingly, and resisting re-traumatization also works to ensure success when treating a victim of sex trafficking. Lighthouse for Life provides free training and modules specifically designed to see and interpret physical signs of trauma, medical specific indicators, and trauma-informed care. The materials used are based off of HEAL, Trafficking Philosophy and Practices. HEAL Trafficking is an organization that offers an evidence-based simulated training for medical professionals to increase their skill when working with sex-trafficked individuals. Simulated programs allow for medical personnel to practice recognizing, caring for, and recommending stimulated patients to appropriate services in a reproduced environment that is not harmful to victims of sex trafficking. Research shows that those who are able to participate in a real-world application without causing irreparable harm to others have a better chance to diagnose a situation of sex trafficking and gaining the ability to intercede, making this a necessity from coast to coast. We are suggesting that Lighthouse for Life train all medical professionals in the state of South Carolina through HEAL Trafficking simulated programs. The societal impact of child sex trafficking is just now emerging in ways that are changing the views and perspectives of those who encounter victims most. These children and youth have been mistaken as criminals and deviants for decades, but as our understanding of the forces behind this tragedy is becoming more sophisticated, ability to respond with effective strategies is progressing quickly. Preparing emergency medical personnel in South Carolina to respond with trauma-informed techniques, empower the medical professionals and victims alike establishing trust and offering a systematic approach to setting vulnerable children on a course toward stability. Our recommendation is about taking advantage of the opportunity to help when it's presented, starting with the people who are charged with caring for the physical well-being of victims who enter into their facilities every day cloaked in the disguise of fear and desolation. Children are highly vulnerable and serve as primary target for sex trafficking operators. In the United States, it is estimated that